older people are particularly vulnerable to natural disaster and crisis, and this has been especially true during the COVID-19 pandemic. They have a complex needs and require a special care during COVID-19 pandemic. They are not alike and may react to the huge of information about pandemic in different way. They are the most vulnerable and dependent group in the society. They are relying on the care delivered by family members or professional caregiver for their day-to-day survival. During COVID pandemic, their vulnerability is likely to be exaggerated due to the direct impact of the disease on them and the direct effect of the pandemic on social support and the healthcare system. Older people with dementia are likely to have a little information or understanding of the COVID-19 pandemic. Healthcare safeguarding procedure such as social distancing, hand washing, wearing mask, or reporting early symptom of the infection may be a difficult task to comprehend in this population, exposing them to higher risk of infection. With increasing social isolation and living alone, people with dementia may have less carer input, which may aggravate their isolation, increasing their loneliness and risk of depression and anxiety. So there has been a cognitive deficit with regard to their working memory, encoding, information processing, comprehension, recall, language, reasoning, planning, and judgment. These defects worsen with the severity of dementia, and the nature of these defects may impair person living with dementia from understanding the nature of the COVID-19 pandemic and the guidelines placed in response to it. Psychological symptoms associated with dementia may make it difficult for older adults to comply with precautionary and therapeutic measures, so withdrawal may manifest as often as agitation, which can worsen ambiguity and anxiety. Social isolation and loneliness are likely to aggravate cognitive defects in person living with dementia. Moreover, patients with severe dementia and behavioral problems, such as agitation or wandering, will undermine every effort to maintain isolation and can be a risk for other individuals, especially their caregivers. The difficulty in comprehension of information may worsen with the large volume of information pouring in each day related to the pandemic and the frequent changes in guidelines. Particular phenomena such as confusional arousal, fluctuation in orientation, glycemic disturbance, electrolyte disturbance, sundowning, visual and auditory impairment might worsen comprehension defects also. So non-pharmacological intervention that depend on physical and social contact, such as speech, activity therapy, or group exercise, may result in decreased cognitive, affective, and physical deterioration, and possible improvement for anxiety, agitation, restlessness, aggression, and other positive problematic behavioral symptoms. There are some tips for caring, as stay calm and avoid being anxious. People with dementia are actually aware of nonverbal cues like tone of voice and body language. They often mirror this signal, so maintaining a composed manner could help them to stay at ease. Limit new exposure. They may not remember the content of the media they consume, but they can recall how it made them feel. Avoid exposure to anxiety or pandemic-inducing coverage and stick with more light-hearted TV shows. Explain the pandemic in a relatable term. Talk to elderly patients about the pandemic in a way they can understand, depending on where they are in the course of the disease. Put it in a context that they can understand and don't over-explain if they are not able to grasp it. Avoid educating a lot of health precautions that may cause them unnecessary stress because they are not capable to learning and remembering it. Simplify the message. If elderly patients ask what's going on, keep your explanation short, focus on the positive, and try to redirect to a topic or activity they enjoy. You can say something like, there is an illness going around, but you are safe inside the house. Can we remember how to play the games or making any simple activity? Set a daily routine. Keep consistent wake up, eating, and sleeping time each day. Try to create a schedule that will help them stay busy and engaged, which will improve mood and decrease challenging behavior symptoms. Focus on meaningful engagement. Meaningful task and interaction can improve Alzheimer patient mood and sleep, decreasing challenging behavior symptoms. Pleasant, stimulating, and meaningful activities that foster emotional connection, engage the sense and trigger memories, and are most helpful. These can include planting seeds or arranging flowers, listening to music, watching favorite old movie or TV show, and so on. So for motion, activity, physical activity, cognitive and functional stimulation, it's necessary to make the person with dementia participate in the daily task and leisure activity. Caregivers should facilitate movement and psychomotricity for maintain good physical condition along with cognitive stimulation by using psych stimulation activities as cognitive exercise, board games, reading newspaper, puzzles, and other activity. These measures help maintain autonomy as long as possible and keep the maximum cognitive activity dependence on the person's ability. And on the other hand, following daily assignments that have a cognitive component and they are significant for the person with Alzheimer's disease, as make some small household responsibilities. Another activity could be the conversation about objects which with a strong emotional charge, letter, postcard, old photographs. These activities stimulate and entertain them and improve their self-esteem because they feel useful. Also, it is important to connect older adults with technology for decreasing feeling of loneliness and improving the mood. Never leave them alone during the confusion. Confusion is one of the biggest challenges that a caregiver needs to manage with Alzheimer patients. They are often more confused when they have any underlying illness that needs to be diagnosed. Confusion won't directly contribute to getting infection, but unusual wandering may increase the risk of contamination. The caregiver must ensure that adequate medical advice is considered if there are signs of confusion, and the elderly shouldn't left alone at home at any cost. Also keep the door probably closed to eliminate any chance of escape. Be in touch with the medical practitioner. One of the critical aspects associated with caring for an Alzheimer patient is to be in touch with the medical practitioner. The regular medication must be given to avoid any chance of unusual behavior or confusion. If there is any symptom including cough, fever, breathing problem, one should immediately follow the unnecessary precaution. Health precautions include quarantining the elderly and maintaining social distancing and limit the amount of caregiver caring for them, using appropriate personal protective equipment like gloves, mask, and sanitizer, washing hands with soap and water and sanitizing hands whenever touching a common area or object, avoid frequent touching to their mouth, nose, and eyes, informing the medical service provider if the symptom worsen, restricting visitors and using audio calls and video calls for communication with friends or other, and order medication and food online if possible. Focus on safe hygiene and frequent reminder. People living with dementia may need extra and or written reminder and support to remember importance of hygienic practice for one day to the next, because those with Alzheimer and other types of dementia may forget to wash their hand. Setting up a schedule to do a hand washing or an regular basis, or having sign in the bathroom and kitchen to remind them to wash their hand for 20 seconds. Also, physical demonstration of the behavior can be helpful to guide the person with modeling good hygiene. Create a safe environment. Keep elderly with dementia safe from falls and injury to avoid having to go to the hospital or emergency department. Removing any triggering hazards, thing or equipment. Always clean surfaces and other frequent touched area, including countertops, doorknobs, and keyboard handles. And finally, vaccination. Vaccines are an important step in protecting the health and safety of people with Alzheimer's disease or other dementia. as well as their caregivers. Now that vaccines are widely available to the general public, and the most older adults have been vaccinated, but vaccinated individuals can still be infected with COVID-19, particularly if they are exposed to people who haven't been vaccinated. So safety measures also must continue to be implemented to ensure a secure and safe environment for visitation. And thank you.
شكرا أستاذة دكتورة